Welcome back to the podcast.
Welcome back to How to Be Patient, your favorite second season of the podcast where we tackle psychiatry, medicine, and occasional existential dread. A little bit more dread this episode than others because we'll be talking about a topic near and dear to our hearts and, well, crispy setters, burnout.
Burnout. Who doesn't love it? Who doesn't love a little burnout?
So for the start, our icebreaker today is going to be the most unhinged thing you've ever done while burnt out.
Oh.
Or to try to alleviate burnout.
Well, I mean, I think the answer for me is obvious after finishing call last year, and it is the Panera Supercharge lemonade.
Oh, tell me more.
It's unhinged. You heard about this. It's the Panera. Well, allegedly.
What they are. I want to know your relationship to them.
Bad. Well, I can't get them anymore now. And I also don't do 24-hour calls anymore. But when I did do 24-hour calls, I think I once had 4 large supercharged lemonades from St. Louis
Bread. That's 1,000 milligrams of caffeine, I think.
It wasn't so good for the old ticker, but it was, it was what it was. I don't think that's super unhinged, though, because I feel like that's high caffeine intake, but...
Yeah, I took a lot of caffeine. I think it's vanilla on the spectrum of unhinged things done in...
Vanilla...
Well, I'm sure they were lemon flavored.
Okay, well, you tell me yours.
So, I guess this was outside of the hospital. I remember I was pretty burnt in medical school, and this is when I was still trying to gun for a surgical specialty. So I remember being in an American Eagle at the mall. We were returning some pants, and I was looking at all the workers, and they were just folding jeans. And I was like, wow, I'm so jealous of these people folding jeans. So then I went over and I started pulling job applications from they had a little sheet hey, we're hiring, inquire. And I started reading it and I took one with me and I was like, it could be nice, honestly.
Did you apply?
The jeans? No, I never ended up applying. So I didn't do anything that unhinged, but I think it was kind of one of the I put my toes over the edge but I didn't jump situations.
Yeah.
And I think maybe it's a rite of passage. If you haven't been envious of a retail worker at some point in medicine, maybe you're a superhero.
Have you ever worked in retail?
I have, yeah.
Okay, so you're aware of the levels.
I worked at a frozen yogurt shop, actually.
Oh, nice.
So,
did you ever cry in a freezer? Because that's also... I used to work at a Chili's. Shout out Chili's. Shout out Triple Dipper. I need to stop saying... I'm going to get yelled at for saying shout out, but I can't. I'm addicted to it. I'm sorry.
I saw a TikTok of a guy who he got out of prison. The first place he went was Chili's, and he got a Triple Dipper.
Burnout Central. Honestly, Chili's spots. I would get better from a Chili's burnout party.
Okay, so you were crying in the freezer of a Chili's?
Well, I was more just saying generally retail, but who of us haven't cried in a bathroom in the hospital multiple times throughout our career so far in medicine?
Yeah.
So that doesn't make it different.
Let he who has not cried in a hospital bathroom cast the first stone.
Order the first Triple Dipper.
Okay, well...
crushed.
So... as we kind of get into the definitions of burnout and kind of clinically how it lines up in our lexicon of diagnosed mental disorders, discussed mental disorders, and I think pop psychiatry or pop psychology, wherever that falls in there, I want to introduce you to the founder of Burnout. So the story is going to start with a guy named Herbert Freudenberger.
What a name.
Yeah. So we're going to rewind the clock back to Nazi Germany in the 40s. He's a 12-year-old Jewish man or boy at the time living in Germany, and he managed to escape and come to New York completely alone as a teenager.
Wow.
So he began working odd jobs and did construction and other things just to survive in New York at first, and then eventually he got into education and became interested in psychology. So he actually attended New York University and began working in some of these clinics around New York with some of the most underserved populations. So I think because of his history as a refugee and someone who's been an outcast in their country, he gravitated towards these populations. So he's working really long hours in all of these different clinics. And he noticed this kind of strange phenomenon that was happening with even the most well-meaning workers.
Hmm.
So he recognized that it wasn't depression, it wasn't anxiety, but people that really cared and were almost called to medicine and altruistic and passionate at first about taking care of these populations were becoming jaded and
Mhm.
cynical and frustrated. And he kind of recognized this as something that was distinctly different from everything that he'd seen before. And the way he described it was like they had a flame before, the flame of passion or of service was burning, but
Mhm.
now that had been snuffed out or burnt out.
This is reminding me of the episode that just when we're filming this just came out on the coping skills, and that there's a bit in it of you talking about how you're feeling currently. And it was like every day is mundane and I'm bored. Like I just everything's the same. It's reminding me of this.
Yeah. So actually I stole that line from The Sopranos.
I need to watch that still.
Yeah, one
That
of the
was my
characters
promise to you that I
goes,
would watch it.
he's like, I'm just so tired of the regularness of life. And that really resonated with me. So um,
So it
I
sounds like
use it
these people
I use it
also
to capture my experience sometimes.
lost their spark. He
So
was
yeah,
finding that. Yeah.
as he writes about this term in 1974. So this is kind of right on the edge of the empathy revolution in medicine. I think in one of our earlier episodes, we found a
Yeah.
paper in like 1969 that was like, it turns out like relating to a patient's experience can be helpful for the overall care they receive. Like,
Proof?
see more empathy at the bottom. And we're like, whoa, revolutionary concept.
Maybe not
Anyways,
acting like a robot would be cool.
yeah, pay more for you. It's like you don't have United Prime, so you don't get empathy with your current coverage plan.
You
Fill
just
out
get
these
the AI
forms,
bot.
bitch. So, anyways, the term burnout,
Mhm.
it struck a chord. So other people really in high empathy professions, so things like education, social work, and healthcare, started to grasp onto this, and other people took it and ran with it. So this the next name I want to introduce you is Christina Maslach. So she actually took the definition of burnout and started to formalize it into a scale,
Mm.
which is now known as the Maslach Burnout Inventory. That was introduced in the mid 90s was the last I saw from a PDF I downloaded. And then with her scale, actually, she wanted to take these concepts of burnout and then orient it as this kind of existential mismatch
Mm.
between someone's values and the institution that they're working for, or like the rules that they have to uphold. And that kind of started the groundwork for a discussion around moral injury.
Mhm.
So, Freudenberger, he ended up dying in 1999, but about 10 years after that, we really started to pick up with burnout as a mainstream topic.
So, like, late 2000, 2010s.
Yeah, and I think that's when I first started hearing about it being brought up.
Mhm.
So when I say burnout now, kind of like looking at how we define it, what is your understanding of it as a syndrome?
Um, I guess my understanding of burnout kind of I think it exists, but it's not something that I know how to define in terms of our specialty necessarily, and, like, in terms of, like, a pathology. Maybe because I don't know that it is a pathology, right? Maybe it's a normative way of making sense. But in terms of burnout, I feel like elements of like this job, I don't find meaning in this job. I don't find
Mhm.
purpose in this job. In some ways, like it doesn't even have to be that it's an inherently meaningless job. It can be like
Mhm.
just the number of reps or volume or stress, and how unbalanced maybe it is with the rest of your life is kind of what I think of with burnout.
Yeah, and that's ultimately correct. So if you're ever hearing or discussing burnout, it's not defined in the DSM. So as the American Psychiatric Association hasn't acknowledged it as a disorder. So we could classify it as a normative reaction, but the
Mm.
World Health Organization classifies it as like a workplace hazard.
Yeah, that makes sense.
So just as you described, there's kind of three tiers. So mentioning like having frustration with work or meaninglessness kind of falls under this category of personal achievement. So people have low feelings of personal achievement.
Mhm.
People will feel detached from their work and they'll feel emotionally exhausted. And those are actually the three categories on the Maslach Burnout Inventory. It tries to assess these things that are really almost like philosophical concepts rather than the classic symptomatic criteria that we like test for. So things like worry,
Mhm.
mood, and then our behaviors. This is really what is your disposition towards the work that you're doing? I think that's kind of why it's hard to lump in with the other disorders that we talk about in the DSM.
Yeah. I mean, I think it's also like the cultural component of what is allowed to exist in the DSM or be validated as like, this is something that needs to be treated and we need to have a solution for. I think that burnout, in some ways, like if it's recognized as something that needs treatment, care, or support, then, well, what are we going to do with all these healthcare workers?
Yeah, like if we pathologize first of all, some people feel indignant about that because it implies that they are broken in some way or that they've become sick in some way rather
Mhm.
than it being like a flaw with the system. So that's one reason why people are frustrated with that. I think that there's more nuance to it than just that can
Mhm.
capture kind of both ends. I think staying positive in a pretty oppressive environment is can be a sign of resilience, but also becoming jaded doesn't necessarily mean that you're weak
Yeah.
either. And I think that's where people immediately go with those two things.
It's kind of like a canary in the coal mine type thing too, of like who feels burnout in different settings, who's
Hmm.
and what do we make of the people that are burnt out and like actually seek support for it versus like are burnt out and just kind of soldier through it. Um,
Yeah.
which I think is sort of valued in healthcare to just be able to push through it and hide it. At least has been, I think, historically.
Hmm. And so one thing that we can do is we can fit burnout into how we conceptualize these other things that we do diagnose. So, for anyone who's listening in healthcare and you're trying to say, like, how do I put burnout on the differential diagnosis? I would think about it as one of these like contributing contextual factors for other things we can diagnose. So, let's start with moral injury on one side. And this is an example of when the easiest example is when you're told to do something that you don't believe in.
Mm.
So, if you're a flat earther and you have to go out on the street and sell
Which
globes to
famously
people,
you are.
yeah, me and Bob, we're out there
Shout
being
out B.O.B.
forced to
That one song with Taylor Swift slept
we're being
on.
forced to preach spherical Earth literature to people, and we absolutely don't believe it. We think it's wrong. We think it's amoral to do it, but
Did you
because of our
see that
job, we
meme you
have
sent
to.
me? Who you calling flat?
What's a time where you think you were morally injured?
um, I feel like there have been times where like working honestly, you're gonna call me a gunner for this, but I feel like there have been times in training where I wanted to like have more patience or like be expected to be more thorough in like presenting a case in psychiatry and it wasn't the expectation and when I would like ask questions because I had gone more in depth maybe on a patient, it was kind of like discouraged, which makes me sound so annoying. But oh well.
Are you sure that's not ego injury?
No, because I was bored. Like that was a moral injury. It was also like, oh, you don't need to do all of that for the patient. And I think part of
Mm,
me really valued what I see now in psychiatry and then was like, no, like I want to be like my friends in internal medicine or surgery or
mhm.
pediatrics, not in a like,
You're trying to do what you thought was right by the patient, and
I'm
that was
trying to
being
be
discouraged.
thorough and know enough to be able to like make it simpler and get some of the understanding to the patient and to
Mhm,
like respect the privilege that it is to be a psychiatrist. And so I think that it was
mhm,
injuring to me because it was like, "Oh, am I like I don't want it to be weird that I want to know these things in our specialty." I don't think it is for the most part, but like I've run into enough where I'm like, "Oh, like
mhm.
I don't know, I want there to be more."
Yeah,
What about you?
so I have a good example from my sister, actually. She's an ICU, crit care fellow. Soon to be she's gonna be attending in, like, 2 months, so shout out to Heidi,
Hey.
but She was telling me a story one time about a patient that she felt should not have been DNR DNI.
Mm,
She felt that he didn't have capacity
yeah.
because he was delirious. But the guy was, I guess, he was a writer and he had a really high cognitive reserve, and he used these big words even as in his delirious state. And he was making comments like, um, you can't override the autonomy that I have to make my own decisions, and kind of repeating these like canned complex phrases. But
Mm,
then when she tried to engage with him about like what's happening medically, he couldn't sustain his concentration. He couldn't even repeat back simple things.
mm,
But the way that he was able to kind of articulate that in his disorganized, rambling, to him disorganized, but to other people kind of coherent, they said that he had capacity and allowed him to make himself DNR DNI, and then he
mm,
he ended up passing. And this was like starkly against what Heidi felt was like a treatable condition. I think it
mhm.
was like he just needed a round of dialysis or something, and he could have survived.
Yeah. Yeah.
So so she had to functionally let this person die who she felt like she could save, and it was because of the decisions of other people. She was a consultant in this
Yeah.
case.
This made me think of an actual one. I feel like also this is one that a lot of psychiatry residents will be kind of familiar with, or med students who've been on psychiatry, that even being where I am, which is Massachusetts, which has a more robust kind of coverage health system and mental health system in a lot of ways compared to other states, there's still like the issue of state hospital coverage and enough beds for people who have like SMI, severe
Hmm.
mental illness. Um, and what like end of life care for people with like severe, like lifelong schizophrenia, where, the medicines we're giving them aren't necessarily helping them. Sometimes there's also been, comorbid substance use. It's hard to like maintain health when you're like houseless and you've gone through living life, especially depending on how much like family resource or extended community they have. And so what I feel like is a common thing and that I experienced and it just like was kind of horrible during residency in my second year in particular was having someone who was in like their like late 70s had been in the hospital inpatient for a year because they were just waiting on a list for a state hospital. They didn't have like any family to speak of at this point in their life. Their kidneys were not great. Like they'd had a stroke before. They were end stage and like they weren't on dialysis, but they were like and like almost there in terms of like type 2 diabetes. And their blood pressure was always like 100 and it was like always high, like 160 over 90 or something like that. But it got to this point for like a month where it was like 200 over like 150 like every couple days. And there was like no plan for like when is this high enough that we're like medicine needs to intervene because if you need medicine to intervene, then it's a ligature risk because there's lines and stuff. And so they have to be on medicine, but then they're restrained because this patient was so like just so in psychosis and none of the meds would touch it. But it was like we know like residents would rotate through and like there was a difficulty in the actual situation, but also difficulty in like who was going to take ownership in this teaching setting for this patient and say like he doesn't really have a guardian who's involved. Like he doesn't have involvement from the state in a like concrete way. How do we figure out this system so he doesn't get harmed and is protected as much as we can, and also that
Hmm.
so that nighttime nursing and the nighttime call resident doesn't have to be like his blood pressure is 220 over whatever. Like, are we just going to have this person like have a stroke on the inpatient unit? Like that that still bothers me. Obviously, that was
Yeah, it's
one where it's
just like a revolving door of kicking the can down the road.
well, I remember asking someone, like, leaving something, say like, coming up to like, writing up things, like, tracking down cardiology, like, on the weekend when I was on call and being like, "I have this patient during the week. I have extra time. Let me see if I can get, like, a concrete plan." And then getting, like, having an attending call me in who had been covering that patient the rest of the time and was like, "You shouldn't have done that. Like, that's not, like, that like, I that is" like my job to do and da 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 da. And like mind you, I'd been on that team. And so it was like this was also an attending that was like not going to do this. Uh
Hmm. So you're trying to like
sorry.
do
It
right
still
by
makes me
people,
like
go above and beyond, and then it's being seen as undermining them.
Yeah, and it wasn't even like an understandable undermining. It was like, you just weren't going to do this. Like, it still makes me both mad and sad and frustrated and like, ugh, sorry.
The one that gets me the most in psychiatry is involuntarily committing people or emergency detentions. And I think like where I really so I understand when it's necessary, and if I agree that it's necessary, I think I have a much easier time with it, and it still sucks. And people kind of let it all out in a verbal barrage on you and all the reasons why, like, you're the most evil person ever. And it's hard to hear in any context, but I think the worst for me is like when I'm on call, it's like 2 in the morning or something, and we don't have attendings in house. We call them from home. I don't know what
Same.
other programs do. Yeah. So you call the attending, you present, and you say, I really think that I can safety plan this person and get them home. And then the attending basically says, they should come in.
Mhm.
And I'm like, but they won't be voluntary. Okay, then commit them. And then they just hang up and go back to bed. And you're like, that was so easy for you to say, huh? and then
Yeah.
and then you have to go tell this patient who's started off the interview with you crying and sobbing, saying, all I want to do is go home. And
Mhm.
I believe they're safe to go home.
Mhm.
I tried my best to pitch that they're safe to go home to my attending.
Mhm.
And like, for whatever reason, they don't want to be the last person to touch this hot potato,
Right.
um,
Yeah.
or how they see it. And, so the person who's making this decision is like in bed sleeping, knowing someone else is going to handle the buck in the morning. And then I have to be like the terrible person in their eyes, doing something I don't believe in, taking
Right.
away their rights and committing them to an inpatient psych ward.
Right.
Like,
Right.
and there are call shifts where you do that 2-3 times,
Yeah.
at the VA and then at our county hospital and then at our military hospital too. It's so demoralizing,
Mhm.
I
Mhm.
hate it so much.
Yeah.
And I try to detach myself from it and say, like, I'm not the one making this decision. It's not my license. I shouldn't care so much. But like it's in such stark contradiction to everything that like I philosophically and rationally believe in as a person who can who to an extent understands justice.
Mhm.
Like I think that's where I get the most moral injury, I guess.
Yeah. I think there's a part of psychiatry that is very misunderstood from the outside, not from the patients. Like, I can actually, like, take quite a bit from patients in terms of, like, however they're experiencing me or the clinical situation, especially in, like, when you're saying. But, like, it's I remember I had someone be like I was working in a children's hospital, and, like, they had a patient I wasn't covering in, like, the emergency department, and they like, were working next to me, and I had gone and, like, had been assigned this is, like, my intern year, assigned one
Hmm.
of like, a psychiatry patient to cover as, like, the medicine backup intern, whatever, during this, and I came back, like, an hour later than sign out and was like there was basically just, like, security had to be called, it was, like, first break psychosis, like, this kid got super dysregulated and violent and, like, had a parent there who was, like, emotional and crying, and it was, like, late at night, and so I come over and this other resident is like, "Oh, well, you must have, like, loved that. You're psych." And I was like, "Girl, you gotta be fucking kidding me."
It's like just like how I love appendectomies.
Just like how you love losing someone in, like, the ICU during surgery, right? Like, "Girl, what?"
Yeah.
I was like, "Girl, so confusing."
You imagine it's like someone has a stroke and they have locked-in syndrome, and you're like to the neurologist, you must have loved that because you're
You must
neuro.
love
Such interesting neurology, right?
so, famously, pediatric oncologists love when kids have cancer. Like, "Girl,
Yeah.
why
They're
did you
like,
say
this is
that?"
so exciting. You have leukemia. Oh
Ugh.
boy, oh boy, oh boy, oh boy, oh boy. So
Um,
I think we've done a good job covering like our experience with moral injury. Maybe we use this as a chance to debrief a little bit more than we intended. But I think the point is moral injury kind of sits outside of burnout, but it can be something that contributes very directly to burnout in those three different categories. So emotional exhaustion comes from your ability to feel recharged at work, how you feel about going into work. And the questions from that MBI will be things like, do you dread going to work? Do you feel exhausted at work? Can you feel recharged after work? And then the second part of it is depersonalization, which is something that I got at earlier. Like, how do you detach yourself from the outcomes of your patients? Do you feel like
Mhm.
your patients blame you for things? Do you find yourself viewing your patients as an object rather than a fellow human? Or do you find yourself not even caring what the outcome of the patient is? And then the last one is personal achievement, which is, do you feel like you're making a difference? Do you think your work is meaningful, and do you think your work is just? So the questions are all around that. And I'm using it as a segue into our responses to that. So, Margaret, I had you take the
You
MBI,
did.
and what was what was your reaction to it?
Um, I think that we can talk about our reactions right after this break. Do 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 do.
Boo. One thing that's always been challenging about being a lifelong learner is being a lifelong test taker. And I never felt like there was any organized medical resources that I could use for my in-training exams. That is, until I discovered Now You Know Psych.
And if you're leaving training like I am, you still have to be preparing for the test that is the boards. And Now You Know Psych is a medical education resource to help us retain all our knowledge, get better, and get ready for these tests.
Yeah, and one thing I really like about the resource is that it has 1,500 questions in a Q bank, associated flashcards, and categories from epidemiology to biochem, so you can really focus on your weak areas.
Ready to take your exam prep to the next level? Go to nowyouknowpsych.com and enter code BEPATIENT at checkout for 20% off. That's nowyouknowpsych.com.
And we're back with the hotly awaited results of our Maslach Burnout inventories.
How burnt out are you? Can we get some graphics?
Are they crispy chicken nuggets? Are they charred pancakes? Or coal at the bottom of a Coleman grill?
Every healthcare worker's favorite pastime. How burnt out are you?
I made
Take this
I made
survey. Take
everyone
this
in my
hour-long
workroom
survey.
take this today, by the way.
You didn't even give them pizza after.
I printed it out, and like the residents were scoring very high, and then we gave it to the social worker. Her score was like 4 on the whole thing.
Maybe she's just better at coping than we.
She was like, honestly, I'm feeling pretty good. And I was like, what, Andrea, what's going on? And she was like, you should have given this to me when I was a 5th grade teacher. I was freaking
I was
burnt.
going to say shout out teachers. I was like, also
Yes.
teachers, how burnt out are you?
If you're a teacher, take the MBI, give it to your friends right now and see how high
And
you
do
score.
what?
You may beat doctors. Yeah.
And do
Bragging
what?
rights, of course. That's
Say,
why everyone does it.
Sisyphus is comparing rock size right now.
Did you see, I saw a tweet that was like, I think Sisyphus would be much happier, satisfied even if there was a point system where he could earn a score when he got to the top, and then he could redeem those points for fun stickers to decorate his rock with.
Well, that would kind of work for me, actually.
Yeah. I mean,
I'm just
and then
having
maybe change the
flashbacks
scenery of the mountain too.
every episode where you've talked about how you're going to be super chill this year and not track anything about something. And then every clip in the last season of you being like, I'm actually running a marathon. I'm doing a push-up challenge, actually.
Oh, yeah. We don't need to get into my calorie tracking over the last...
I didn't even bring that up. But you're free. Your chains are broken.
Yeah. We're not discussing this now, but I've been in a calorie deficit for last month, and I quit it yesterday.
And my texts to you were like, girl, free yourself.
Okay, let's stop making them wait and tell them what our MBI scores are.
Well, there's 3 parts.
Mm-hmm.
Right? So we have to give them the context. Give them a crumb of context for the first.
Okay, so
the range.
Criterion A is emotional exhaustion. How did you do on that one?
I got 18.
Okay. So 18 will put you in the moderately emotionally exhausted range. Medium. And then section B, depersonalization.
10.
So I think is that mild?
Mildly depersonalized.
Oh, no. Sorry, 5 or less is low-level burnout. So 6 to 11 on that one.
Is it bad that I was filling this out and I was like, I looked at the scores a little bit after and was like, okay, what kind of dream world are they living in?
No, seriously, that's how I felt. So
that's
like, also moderately
better than me
out.
in healthcare right now. Like, I'm a 4th-year psych resident.
And then finally, personal achievement.
I got a 40.
Oh, so you're not very burnt out in that one. You still feel very fulfilled from your work.
Yes,
So
sounds
you're
right.
stressed, you're exhausted, you have some depersonalization, but you recoup well. So you want to score high in the third one.
Yeah.
It's protective against burnout. You don't want you want to do whatever you want to do, but high in the third category is protective against burnout.
What are your
So
scores?
I
Are you
scored,
gonna tell me I'm a depersonalization rising? I'm a
yeah,
personal moon. I'm a I'm an exhaustion Venus.
yeah, I'm an asthmatic and a Capricorn. So my burnout, emotional exhaustion was a 33. So that's high.
Yeah.
And like I knew it going into it, like how I feel like as like some of these thoughts are like embarrassing to say out loud. And then it was like exactly what the burnout questionnaire was asking me about.
Mhm.
And you kind of feel validated, but also like a little embarrassed, I think.
Yeah.
I scored I think a 22 on the depersonalization one.
Oh,
So it was
damn.
also high. And then I think I scored like a 36
On the
on the
last one.
personal achievement. Yeah. So that one was like, okay, that was moderate.
Did you ever have to take one of these for your, like, institution in med school or in residency?
It wasn't this one in
Uh-huh.
specific. But yeah, we took some of them.
We had to take one in med school, and I remember it would spit out, like, at the end, it would tell you your results and then give you suggestions, and it was like, "Consider exercise and, like, connecting with friends more." We were like, "I feel
Yeah.
like."
It comes across a bit patronizing, I would say. So when I first entered residency, we took a questionnaire that was like it was a risk burnout questionnaire,
Mm,
actually. So I remember the questions were, are you from out of state? Do you have family in the area? They were like, was this your top residency? Or like, was this one a choice? Do you find this to be a desirable place to live? Um, then it asked you a bunch of like mental health questions too, like if you've been diagnosed with depression in the past or other things. And I remember like my burnout risk was very high going
wow,
into it. And
really?
I was kind of like, I was offended a little bit. I was like, okay.
Like, "I would I'm the best at not burning."
Yeah, I was like, all right. But then it was totally right.
But
So
then
I'm
it
like,
dunked on you.
yeah, like who has the last laugh now?
That online burnout question.
Yeah, it got me. And I think it was like for them to assess like what are residents' risks of burning out. Um, so I wouldn't it doesn't mean that like you can't improve any of these things. And like I said, it's more of a syndrome rather than a full-blown disorder.
Mhm.
And that's kind of where I want to go next with the conversation, which is the difference between burnout and depression.
Yeah,
And I think that's something that a lot of people in pop psychology use almost synonymously.
right.
Like I have a lot of burnout. Yeah, I have depression. Um,
I think one of the questions someone asked is, like, related to this on my, like, Instagram poll thing, which I put with the nervous breakdown book that I found yesterday. Uh, but they asked, "How do you know the difference between burnout and just being in the wrong field?" Which is different than what you're saying in terms of, like, depression, but I think it's this
mhm.
related thing of, like, what does this mean? Does it mean something like needing to see a psychiatrist for depression or anxiety or what have you? Does it mean that I'm in the wrong field or in the wrong profession? So yeah, I think that that delineation is super important.
Yeah. And so I think to answer that question, how do you distinguish between burnout and being in the wrong field? I think from the outside, it's almost impossible to tell. But a way that you could go about figuring it out is to see what helps alleviate that burnout.
Mm,
So someone who's in the right field, so to speak, or a field that would otherwise be fulfilling for them, but because of other extenuating circumstances is burnt out and experiencing this syndrome of
mhm,
emotional exhaustion, depersonalization, and low personal achievement, could have that recharged by a 2-week vacation or changing jobs or something. But if none of those things can be alleviated, and it seems to be the nature of the work itself, that would be kind of how you distinguish those
mhm,
things, I guess. And so I know a lot of like people in psychiatry that felt burnt out at a specific institution or in a certain clinic or
mhm.
certain side of psychiatry, whether it's inpatient or outpatient is a classic one. So I think change like introducing change and then kind of seeing what change was helpful and what change wasn't helpful would be the way I would distinguish between those. And then we recall that like depression is this syndrome of a lot of behavioral and mood changes. So depression is sadness that is not alleviated by getting out of work. It
Mm.
doesn't get better no matter what.
Yeah.
And it's not tied to a situation. And I think that's the best way to distinguish between burnout and depression.
Mhm.
So, burnout, everything around it is fixated on the work that you're doing and how exhausting that work is, which is why the questionnaire has to do with dreading going to work in the morning. A depressed person and a burnt out person can both dread going to work in the morning, but also that inability to get up still exists for that depressed person on their day off. And it's not to say they're also mutually exclusive. There can be
Mhm.
burnt out people that aren't depressed. There can be depressed people that aren't burnt out. And there can be people with burnout who are also depressed.
Yeah. And, like, from that survey that your residency sent you, like, having prior episodes of depression or, like, anxiety disorders is also, like, a risk factor for, in some
Hmm.
ways, developing burnout. I think also, like you were saying, with burnout, there's some overlap in this, but, like, anhedonia and depression would impact everything sort of the same, whereas with this, there may be spillover in terms of, like, stress management and things like that outside of the job, but that kind of blunting of enjoyment would be more sequestered in the, like, work and work-related part of life.
Yeah, absolutely. So I guess to use myself as an example here, um, my intern year, I had to be started on antidepressants and I experienced like a depressive episode. And I think one of the most salient things that told me something was wrong was when I went on vacation
Mhm.
and I didn't notice a change. So I I joined my friend in Park City to go snowboarding. It was like my first vacation of intern year. And old Preston or normal Preston would be like very excited to do something like that. And I was sitting on the ski lift, like going up.
Mm.
And usually this is a feeling that's like Christmas morning for me.
Mm.
Like finally getting to like go skiing the first run of the season. Anyone who does like winter sports kind of knows what I'm talking about. And I felt nothing. I was dreading it. I was like, everything. This is still. I'm just going through the motions here, but I just there's just nothing when I look at the snow, when I look at my snowboard, the mountains.
Mhm.
Like I'm just here,
Yeah.
and that was pretty unsettling. I was kind
Yeah.
of like, holy shit. This is supposed to be reprieve. This trip that I was planning. I'm in this fun part of the town, like part of the country. And I'm skiing, and I
Right.
can enjoy this. What's going on? And then I think this year, I fortunately I got on medication. I've been doing a lot better, and I think I'm experiencing burnout this year. And I noticed that like I have similar frustrations at work, but then when I go to run club on Saturday morning, or I go to run my race in LA or something, I get excited about that. I enjoy it. I'm having fun.
When you get to film the podcast.
Yeah, when I come here to film, when I do my latte art,
Yeah.
it's fun and enjoyable.
Yeah. Yeah, so you noticed a difference kind of with the meds being, and then, like, how it was more sequestered to the, like, part of your life related to work.
Exactly. So I'm going to read to you a couple vignettes, and we can kind of talk about the differences between them without needing to filter through Preston's personal experience. So, this first one, Dr. Wynn is a third year internal medicine resident. She feels emotionally depleted, avoids emotional conversations with patients, counts the hours until she can go home. On vacation, she feels better. She still enjoys weekends with friends. She's not suicidal. She dreads going back to work. And when she is at work, she's calculated, she's efficient, but more of a checkboxy manner. And she doesn't go above and beyond for her patients.
So the question is this
So,
burnout or is this
yeah,
depression?
what would this be more consistent with?
I think it's more consistent with burnout because it is, like, about how, like, kind of trying to function in this work environment and more related to,
Hmm.
like, patient care rather than having other factor like, symptoms of depression and being expansive throughout.
Yeah, and I think we kind of highlight the obvious parts of it, which is at work sad, out of work happy,
Mhm.
and so she's able to go on vacation and enjoy things, which is what I mentioned I wasn't able to do.
For that vignette, though, I think this also does get at, like, I was struck by the last part of it where he said, like, she's not going above and beyond for patients, and I I just think that's so part of the burnout equation is the expectation of going above and beyond and doing more and more and more until you're so exhausted that you pass out. That like
Mhm.
in some ways is that part of burnout? Yes, but I think the way I would phrase it with like a patient or someone or a friend would be like, are you doing for this case, like, are you doing medicine in a way that aligns with how you want to be practicing medicine in kind of like reasonable like fashion in terms of like what are actual options of how we practice medicine wherever we are.
Yeah.
Just to say, because I think that that is part of this is like also the guilt, especially in some fields, in medicine in particular. There's different requirements for each field. Like no one looks at me and is like, you should be up at 4 a.m. as a psychiatrist, like they would for a surgeon. But I think of my friends in pediatrics, and it's like how often they get like, oh, like you're both like a hero and well, you shouldn't want fewer hours. You shouldn't want more pay. You shouldn't want this, that, or the other, or more support in the hospital because we're all doing it for the kids. And so I guess that just like came up for me in thinking about this topic of
Yeah,
like the
so
expectations.
the other aspect of burnout is almost like the guilt around not being this evangelical, altruistic human too. Like, you're
Yeah.
not allowed to just do the work. You
Right.
should also feel guilty about that on top of everything.
Yes.
Yeah, I feel that too.
Yeah.
And with the amount of, like, virtue signaling in medicine, it's just kind of thrown in your face consistently.
Well, I think also like I don't know what your this is a hot take. So I wonder what you think about it. The fields that require like kind of like in this the current like model of healthcare, right? Like
Mhm,
operations, interventions are like prioritized from like a monetary perspective. And like prestige historically in medicine has been more in those fields as well. Whereas like there hasn't been prestige and respect in modern medicine the last like 50 to 60 years for like primary care, pediatrics, psychiatry, like palliative care. Like these are the fields that are like when we're I don't know for you, but when I was in med school, it was like, oh, you want to do psychiatry? Like good for you. We need people to do that. Like we
mhm.
need this. And
I
it's
could never.
I could never. Yeah. And it's interesting in that it like these fields all include more emotional labor and it's it's interesting that that part is undervalued and I think that is part of the like burnout question for a lot of people is this undervaluing both monetarily and societally of like what is it that the work we're doing why can't you see 30 patients a day like why is
Mhm.
that you're just sitting and talking to them.
Yeah, the high empathy specialties, get devalued.
Sorry, that was kind of tangential but
No, I think it's a fair take and something I hadn't thought too much about, that, like, that's a uniting feature between less prestigious specialties.
yeah.
So, this next vignette I have,
Mm.
Derek, he's a 29-year-old accountant. He's lost interest in his hobbies. He doesn't feel like eating, even when he comes home from a long day at work. He feels worthless. He doesn't wanna socialize or go to the bar with people after he gets off of work. He struggles even executing tasks, and, he starts to fall behind on deadlines. He starts to think that he's a burden to other people and that the world would be better without him. And it doesn't really matter if it's the weekend or if he's working. Everything just feels heavy, and he just wishes he didn't have to exist.
So there's a safety component.
Hmm.
There's also these kind of physiologic parts of it with the like lower appetite, low energy, isolation, amotivation.
Yeah, and we see that his mood doesn't respond to his situational change,
Yeah.
which is an important, like, distinguishing factor.
Yeah. It is. And it's like, I'm just thinking of some of people like you talk to people who like have just gotten out of residency or get out of intern year and then their next year is like not as hard, whatever. And they're like, I think it's helpful because we need something that defines these two things. But I also have had people where it's like they're gone for a week on vacation and they've been so over like anxious and stressed and overwhelmed from their environment that like the vacation didn't fix it for them. They didn't feel better during that. But when they moved jobs
Hmm.
or when they actually finished residency and like had time, like
Yeah,
real time off to like, then they
like
did
2
feel
months.
better. Yeah. It's like,
Yeah.
is that depression versus burnout. I don't disagree
No,
that
I think
there's
it's like the dose wasn't high enough, if that makes sense.
yeah.
Like, if that vacation was Tylenol, they took, 50 milligrams, but they needed to take like 1,000.
Mhm.
I just my little 2-week vacation is just not a strong enough dose to wipe out my burnout.
But I think well, okay, here's a question I have for you with this. Sorry, I'm going off your script.
Mhm.
'Cause I run into this a lot, not with burnout, but with, like, the perinatal clinic where it's like or I think all of us run into this where it's like someone's in very difficult circumstances that we can't control as their doctor, but we can possibly help them somewhat with an SSRI. And I think about burnout with, like, healthcare workers, like, is it because they have depression that they're feeling this way, but if you put them in different environments, they wouldn't feel that way? Like, it's unfair that they're in this environment, but could we help them in that environment with the medication, even if we don't think it's a pathology?
Yeah, I think so. In some scenarios, it can be helpful.
Yeah.
And I think if we separate the title of like antidepressant from SSRI
Mhm.
there, it can help us reframe that. So we know that when we give someone serotonin or a medication that increases levels of serotonin, it makes them feel agitation at a lesser intensity, makes them feel anxiety at a lesser intensity. So something as simple as like this this shit sucks, you
Period.
know,
Speak on it.
yeah, and it's gonna make you angry. Like you work in a job where you're trying to like uphold an oppressive system
Mhm.
that you don't necessarily agree with, and like your feelings of agitation or frustration and indignation are valid, and this medication will help alleviate some of those that you deal with.
Mhm.
It's not an antidepressant in the sense that you're depressed, but it's helps you get through the day. I think that's how I'd frame it.
Yeah. And I think, to acknowledge, like, what we're saying is kind of controversial in psychiatry. Not super
Hmm.
controversial. I think a lot of people know this, but, like, I feel like I'll bring it up with my patients. Like, I will actually harp on this and say, like, I think the way you're experiencing, like, low support in postpartum, let's say, especially a postpartum healthcare worker,
Hmm.
like, you're going and doing this, you're not sleeping, your, like, relationship is strained because you're both not sleeping, this is happening, like, let alone if there's other stuff like grief happening at the same time. Like, are you do I think you necessarily have a depressive disorder? No. Do I think that there's a chance that an SSRI could help you with this period that is unfair or
Hmm.
whatever? Possibly, and I want you to know I don't locate the problem within you, but I do wanna offer you this support if it could be helpful.
Yeah.
And I think that's important in healthcare too, especially when, like, people are made to feel like they should just be able to work 80 hours and not blink, like I mean, not me. No, that's not me. But
Yeah. I don't flinch.
I don't work 80 hours.
So, you know, in summary here, kind of taking a step back and looking at moral injury, which we discussed, burnout and depression, I would say that um, burnout would be the saying "I'm exhausted," and moral injury would be I've been betrayed,
Mm,
and then depression would be um,
I'm depressed.
yeah,
Sorry. Um,
me depresso.
is that me? It's Presro. How have you never used one of those in your TikToks?
So, and I know these are kind of new conversations
Just
on
skip.
old
They're gonna get you in the comments for that.
for what it's me depresso,
No,
just
no,
pressro.
no, no. For when I say something, there are a couple people in the comments who every once in a while, if I'm like just like saying shit and you don't respond, they're like, Preston, respond. Can we cut that out, editor? Just cut the
Okay, editors, you don't have to cut it out.
oh,
Boo, I'm responding.
well, it's real. Season 2, we're keeping it real. I'm
So,
laughing
okay,
less.
dear listeners, if I don't respond to Margaret, it's because my mind is
He
thinking about the
hates
next
me.
thing I'm going to say,
That's
and
true.
also I hate her.
And also, we're
Pick one.
enemies. Also, he's coming for my job, um, which is psychiatry.
So when we come back, we're going to kind of go over some of the directions that we hope society goes with burnout and our own kind of takes on how to fight it. Welcome back to our rapid our rapid fire burnout tips. So Margaret's going to be starting the timer, and we're going to tell you as many helpful tips as we can to fight burnout. I feel like almost underqualified to do
We're
this
gonna say
because it's
pizza for 5
well,
minutes.
we have two burnt out residents, one moderately, one highly,
Yeah,
so, who are trying to tell other people how to not be burnt out. It's a bit of a blind leading blind situation.
that's true. That's true.
But I will say some things do make it easier.
All right, let's ping pong back and forth. Do you want to start or
Okay.
should I start?
Okay, I'm gonna start. Blueberry scones. I make blueberry scones on the weekend sometimes. Those like one bite of those, that's anti burnout right there.
I love that. I FaceTiming my family and hanging out with little kids. This is not for everyone. These are our personal strategies. Take what you will.
Yeah.
I love just getting to giggle with them because I don't have to talk about anything smart.
Okay, venting with colleagues. Real talk. So, like scheduling time to like vent about like frustrating things or debrief, that helps a lot. And that one is actually evidence based. So they've done studies where they like will schedule like debriefs on ICU teams and other things, and that's been helpful for burnout.
Um, I started my TikTok because I was like, I want something that's not at all related to medicine. It wasn't supposed to be a job. Just be like, okay, I'm talking about Taylor Swift. Like, I'm turning all these other parts of me off and like reclaiming my time. So uh, I do think hobby, creative expression stuff doesn't need to be online. Is helpful to take some of that time back, but and giving yourself time to start enjoying it, like that you probably won't. You might not enjoy it the first few times you do it because you're out of practice.
And I think more so than just like hobby and creative
Mhm.
outlets, but identity outside of medicine
Yeah.
is very important. I think when like, especially working in a place where your values may not line up with the things you have to do all the time, if all of your value is surrounds you as a doctor, it's just going to affect you so much more when you have other protective identities against that. So you're like, okay,
Podcaster.
this doctor part of me is like really hurt today, but it's not all of me.
At the end of the day, Preston's just a white dude with a podcast mic, and that's protective.
Yeah. I'm like, I'm just getting slammed on rounds, and I'm like, they don't know I'm going to go home be a a white man talking to
They
a
don't know what I'm
podcast.
about to do.
They don't know how much creatine I
They
had
don't know
today.
about my high value male podcast.
Yeah. Like,
Uh,
so and I'd say with those hobbies, like find other goals to pursue. So like one thing that actually helped me a lot with burnout, I would say over the last couple months was like training for the marathon, weirdly
mhm.
enough, because I had something that I was like focusing on, looking forward to and progressing with outside of work that didn't really have anything to do with my identity as a doctor. So I'd be like, oh, like I'm getting absolutely grilled at work today, but I'm like, well, I've got my long run this weekend. Like, I need to be okay. What am I doing to prep for my long run? I can hit these milestones. I'm like doing well on my mileage. Like,
Mhm.
nice. I'm
Mhm.
just like looking forward to leave work to go take care of this. Balloon Tower Defense was the other thing that was for me when I started getting really efficient at Balloon Tower Defense 6.
What is
If
that?
you know, it's a mobile game
Oh, okay.
that I just play on my phone. It's honestly insanely addicting.
I saw a TikTok earlier today that was like, you don't need a boyfriend. You just want a Nintendo Switch. Like, you just need, like, stop letting him hurt your feelings, girls. You just need a game. And like, we're like healthcare workers. You just need to get a Game Boy. Um, for real, though, I agree with you on that. And I think finding places where you can exert control ethically, is a good thing. Finding things like that you can improve at, like I feel like in the hobbies, not to get too perfectionisty, but like a lot of us in medicine are type A, and in some ways.
Oh,
So do
hold that thought. Sorry.
I'm gonna kill
Keep
you.
talking.
What?
No, keep talking. I'm just going to grab something.
What? Preston, what are you doing? If you get that freaking puppet out, I'll kill
No,
you.
it's not the puppet.
Okay,
I
fine, go get
swear.
it. I'll wait. Listeners, I have you here though. I think that like having something that you can get better at, that you can control, or something in medicine that you actually think you can impact and it can get better. So not trying to push at the part of your healthcare institution that like 20 other people have tried to change and never changed because there's so much resistance, but something that like no one besides you cares enough about to push against you. What did you get? If you got the fedora out, I'm also going to kill you. This is now I'm What?
This is an
I
honest to
can't.
God
All
harmonica
right, Billy Joel,
that
let's hear
I've
it.
been practicing it.
Let's hear it, Billy Joel.
So it came. I found this in my closet. It came with like a little book on how to play it.
But where did you get the book?
I don't know. It
You
just
just
came
bought
with it.
Where? What?
No, my dad gave it to me.
Oh, that's kind of fun.
Yeah. Well, he never used it. It was new when I opened it. You said we're perfectionists. We need to get better at everything. So
Bad
this is
art
what I've
every
been
day. I may
practicing.
live to regret it. Oh, that's nice.
You got a free concert.
That was an interesting thing to watch. That's all I have to say.
The journey of like, and I'm not good at this at all, by the way. I like anyone who knows anything about harmonica knows I probably just messed up a bunch of stuff. The first thing you have to do is even like play one note at a time, which I don't think I can do. But it's a lot of fun to learn something new. And you're like, wow,
right?
A way to express myself that isn't just trying to like be an intelligent, morally perfect servant of the medical system.
Does this mean that we're, in the episode, the last episode that came out was like, my friend texted me and was like, I liked that bit where it was like, oh, we said the name of the podcast. And you were like, Schindler and his list. And we kept going. I feel like now we've reached the part where it's the name of my other accounts, which is Bad Art Every Day. We're full circle there. Hi,
yeah,
Laura.
how to be patient with bad art every day.
Yeah, period. And then we're going to add and Presro. The full name. And then have pets. I'm working on it. I told you I'm getting allergy shots, right? So I can get a pet eventually and not react.
Oh, no, you didn't.
So me a year from now is going to be so lit.
It's coming soon. So yeah, hopefully...
We're out of time. I'll send the pod in 5 minutes.
To all who are listening, hopefully some of those are good burnout tips for you. But we want to hear, what are your tips for us? Because I think we probably need them more than you do on how you fight burnout.
Do you want a full harmonica episode concert?
Yeah, and please
know.
take your MBI scale before and after you listen to this podcast, and we'll see how much we've helped you. Anyways,
hi, cats.
If you have any other opinions about the show, thank you so much for sticking around in season 1. We are excited to keep going with you guys in season 2, and we're going to keep rolling. We have a lot of your suggestions in our DMs, and we're kind of forming a list of topics that we want to roll through, but for both solo episodes and with our guests.
For example, would you want an ASMR episode? I think that's still on the table.
Yeah, and we can roll in the harmonica in the ASMR episode and
maybe
include
some
the puppet
Scottish
show.
Accents. We'll go back to the pelvic floor and talk about that a little bit.
Yeah, I'll use my pelvic floor to play the harmonica.
God, Preston.
Come chat with us and our fun human content podcast family on IG and TikTok at Human Content Pods. Or you can contact us directly at howtobepatientpod.com. You can see more from me and Margaret on my YouTube channel at It's Presro, or on our Instagram, How to Be Patient, which we have our own Instagram page now, if you didn't know that. Margaret's also on Substack as Bad Art Every Day. We respond to all of those intermittently, but if you have a How to Be Patient question, the How to Be Patient Instagram page is the best one to go to.
It's like those little rats in the cage where with the intermittent reinforcement, we're intentionally using it. We're not forgetting to do things and stressed out.
Thank you so much to all of our listeners who take us in your ears on walks.
Take us in
and
your
long
ears,
drives.
God, what is that?
No, somebody said that. They were like, I bring you guys along on my walks with my dog.
But they did not say, I take you in my ears.
No, they didn't. That's kind of weird. Yeah.
Anyway.
Thanks for including us on your walk with your dog, wherever you are.
Yeah.
We're here, and I'm just kind of like picturing.
There's been a couple people also who are like, I drive and I listen to this, and I'm like, that's so great.
Wow.
Don't forget to bully us in the reviews. Say the laughter was just the right amount this time.
Make sure your seatbelt's on if you're driving and listening to us right now, too.
Very true. All right.
Thanks again for listening. We're your hosts, Preston Roche and Margaret Duncan. Our executive producers are Preston Roche, Margaret Duncan, Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Our editor and engineer is Jason Portizo. Our music is by Omer Benz-V. To learn about our program disclaimer and ethics policy, submission verification, licensing terms, and our HIPAA release terms, go to our website, howtobepatientpod.com, or reach out to us directly at howtobepatient@human-content. Sorry, I'm trying to read off the board, and Lilac just kicked the entire mouse.
She's like, you're done here. Human, how
Reach
to be
out
patient.
to us at howtobepatient at human-content.com with any questions or concerns. Lilac, do you have any questions or concerns?
She's
How
like,
to be
yeah,
patient. How to be patient is a human content production.